the fossa ovale is the between the right and left atrium, where in the fetus the blood flows from the right atrium to the left atrium, and it closes up, and so you have what's called the, rather than foramen ovale, what you have is the fossa ovale, and that's what 55 is. That is now a little indentation between the two atria. All right, and then so from the right atrium, the blood flows through which valve?
Tricuspid.
The tricuspid, or right atrioventricular valve. It has 3 cusps, and the cusp attached to what? I'm sorry. Yeah, attached to what? First these. What are these?
Chordae tendineae.
Chordae tendineae. And the chordae tendineae are attached to papillary muscles. Papillary muscles.
Capillary muscles.
And then, so we've started from the SA node, which it should be 32. Sinoatrial node. The impulse is going to then travel to the bundle of His. Right here.
32.
30. Yeah, that's the SA node. Then it's going to go through to the bundle of His, which is probably something. It's 58. No, coronary. Oh, that's where the coronary sinus opens up. What's 34 and 57? Valve. Okay, so it doesn't indicate it. But then you see the right and left bundles coming down the interventricular septum, and the Purkinje fibers that are down in the right ventricle. So the blood comes into the right ventricle, the action potential goes through, it squeezes, this closes off, that you can see on the sheet part, and then the blood has to exit the right ventricle by way of what?
The right.
Pulmonary, what? What do they look like? Half moons?
Oh,
Semilunars. Semilunars. Pulmonary semilunars. Goes into the pulmonary trunk. That's an artery, because going away, and then goes to from the left and right pulmonary arteries off to the lungs. Gets oxygenated. Comes back by way of the 4 red pulmonary veins, and comes into the left atrium. And you'll see 4 little red circles in there where that comes in. From the right atrium, then, it goes through which valve into the left ventricle? I'm sorry, from the left atrium through what valve to the left ventricle?
Bicuspid.
Bicuspid with its chordae tendineae, papillary muscles again. And then we see the conduction system. It's going to cause this to contract. These will close. And then the blood has to exit the left ventricle by way of the aorta. By the left atrioventricular, or the mitral, or the bicuspid. I'm sorry. I'm backing up. By way of the semilunar, by the aortic semilunars that you see way back up in here.
Okay.
Yeah. So these are going to close. The atrioventricular is going to close. It's going to go out the semilunar, similar to this, but now it's going to go into the ascending aorta right here, and the aortic arch.
To be pumped to the tissues.
Go ahead.
Right?
Yes, to the head and neck here, and then it's going to go down and start. There's just small blood vessels that come to your back. But then this is going to come down and start serving all your viscera, and go on down on into your legs. So, but the first blood vessels off of the aorta are the right and left coronary vessels serving the heart, the actual heart muscle. So where is the right coronary artery? Yes, right coronary artery. Why is it here?
How is this
is the right.
feeding into?
So this is it's called the coronary sulcus. It's between the atria and the ventricles, and it follows that, and then it branches off and serves most of the right ventricle, but some of the left, and other parts of the heart.
Okay.
But this is deoxygenated.
This is oxygenated right off the aorta.
The blue ones.
The blue ones are veins. They're collecting it to bring it back to the coronary sinus.
And that will take it to where?
Yes, takes it right back to the heart to go get oxygenated again. But on the left side, we see a little different arrangement. This little stub right here that would again open up at the base of the aorta, behind the aortic semilunar, that's all you have of the left coronary artery, and then it splits into the anterior interventricular between the right and left ventricles, down through the interventricular sulcus, and the circumflex, and then those start branching into capillary beds that then is picked up by the venous system with the great cardiac vein, the coronary sinus, and the middle cardiac vein, bringing it all through the coronary sinus back where we started. Right, Adrian? Ba-boom. Yes?
So all
Oh
those
boy.
blue things, like blue veins.